Aging Matters on BCTV is supported by the Berks County Area Agency on Aging.
Hello, and welcome to Aging Matters. This is a show that's provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet. I'm the Public Advocacy and Outreach Manager for the agency. Thanks for joining us today. Today is going to be the first of a two-part series with regards to Alzheimer's disease. Our topic is 10 warning signs of Alzheimer's disease for today's session. And for the second session, we'll be talking about healthy living for brain and body as a preventative program. And my guest today, I'd like to welcome Kellie Butsack. She is the Associate Director of Programs for the Delaware Valley Chapter of the Alzheimer's Association. Kellie, welcome and thank you for presenting this information today.
Yes, well, thank you, Ann, for having me. Always a pleasure.
There's so much to talk about with regards to Alzheimer's disease and dementia. So I want to start right in because we've got a lot to cover today. And my first question, I think, which might be on a lot of people's minds, is we hear the word Alzheimer's disease, but can you tell us, let's start the show if we can, with what is Alzheimer's disease versus, say, dementia? And if you could start us off with that, I think we can get right on a roll on the 10 warning signs.
Well, yes, Ann, thank you. So as far as the terminology, dementia is a syndrome, and it is a term that's used to describe a broad spectrum of symptoms associated with cognitive impairment. So dementias, all dementias, including Alzheimer's, are a disease state that require diagnosis and treatment and care planning. There are some health and medical conditions that can cause dementia-like symptoms, but that might be treatable and reversible, such as depression, thyroid disorders, vitamin and iron deficiencies, urinary tract infections. And that's why it's so important for individuals to seek a diagnosis if they're experiencing any dementia-like symptoms. Of all the cases, all the diagnosed cases of dementia, Alzheimer's is the most common. And you can see on our slide here that of all diagnosed cases, Alzheimer's disease or the Alzheimer's type of dementia makes up 60 to 80%. There are some other common dementias or more common dementias behind Alzheimer's, like vascular dementia, which is typically diagnosed when a person suffers a stroke or a series of mini strokes. We have Lewy body dementia, which is similar to Parkinson's disease with buildup of Lewy bodies in the brain. And then we also have frontotemporal dementia, or FTD, which really attacks the frontal lobe of the brain. But again, dementia is a term used to describe a broad range of symptoms. So dementia as a word is not a diagnosis. Usually if you have dementia, you have a type of dementia, whether it be Alzheimer's or vascular or Parkinson's or FTD.
Great, thank you for clarifying that for us. So knowing that it's the 60 to 80% is kind of why we're going to hone in today on specifically Alzheimer's disease. And then we're going into, you talked about getting a diagnosis. I think it's good to start with the 10 warning signs of Alzheimer's. So I'm going to let you explain all of those to us. And hopefully, if we recognize some of those, we have a plan for them in terms of a treatment. So go ahead, Kellie.
All right. Well, it's important. I'll start out by saying, Ann, that For a diagnosis of Alzheimer's disease, it is not required that a person have all 10 of these at once. It's going to be different for every individual who's experiencing any type of cognitive issues. They may have one or two of these, they may have several, but it's going to be different for each person. But probably the most familiar symptom that most people associate with Alzheimer's and dementia is the first one, number one, memory loss. And it's one of the most common signs of Alzheimer's disease, especially early on. And it's short-term memory loss that goes first. So it's forgetting recently learned or heard information. Others, other signs in this might include forgetting important dates or events, repeatedly asking the same questions because a person forgot that they just asked the question, or increasingly having to rely on memory aids or others for things or tasks that they could once handle on their own.
So Kelly, I'm going to interrupt you real quick. Yep. So that's a little different than some of us who are in one location of our house and want to go get something in another location, and we get there and we went, now what did I come in here for?
Right. Right.
Do I have to
we
start
all
worrying?
Do that.
Okay.
And we can never find the car keys either.
Yes. So that's not what we're really talking about here in terms of
exactly.
that. Okay.
Yeah, I would say the difference being, all of us have that occasional memory lapse where we forgot where we put something or why we walked into a room. When you're talking about a symptom of Alzheimer's disease, it's really memory loss that has become frequent enough that it's happening daily, and it's happening more frequently, and it's actually disrupting a person's ability to function normally. So it's a much more advanced level of memory loss.
Thank you.
Yep. The second warning sign, challenges in planning or solving problems. This usually entails difficulties with what we call executive functioning, being able to develop or follow a plan for the day, being able to do simple math problems. I know a lot of people, when they're having these warning signs, they'll say that they can't calculate a tip or they can't count change. So simple math problems, having difficulty focusing or concentrating, that falls into this category. Number three, difficulty with completing familiar tasks. People living with dementia often find it hard to complete daily tasks that used to be managed with ease. They used to be habitual, such as driving to a familiar place, writing a grocery list, remembering how to play a favorite card game or board game. And again, it's important to point out with these warning signs that we're talking about a change in functioning that is not normal for the person's level of functioning. So it's not like if I am trying to learn a new game or something new that I've never done before and I'm having trouble with it, that would be expected. But if you're starting to have trouble completing familiar tasks that you've been doing for years, all your life, that should be habit and routine, that's when it should be a red flag. Confusion with time or place is another warning sign. An individual living with Alzheimer's or another dementia may lose track of dates or what season it is or the passage of time. They may have trouble understanding something if it's not currently happening in their environment or in their reality, and they may become confused about where they are or how they got there. Number five is trouble understanding visual images and spatial relationships. And this, I think, points to the fact that Alzheimer's and other dementias are not just about memory loss. So in terms of visual images and spatial relationships, some individuals with Alzheimer's and other dementias may experience vision problems. So this can lead to having difficulty with balance, trouble reading, problems judging distance or determining color and contrast. And all of these changes can impact a person's ability to drive safely or be able to navigate in their environment. So for example, if you took a person with Alzheimer's disease, progressed Alzheimer's disease, so maybe they're already in a middle or later stage. If you took them into a room that had a black and white tile floor, they would actually step over the black tiles because they would perceive that contrast to be a whole. So that's an example of that. Problems with language, speaking and writing. Individuals may have trouble following or joining a conversation, keeping up with normal conversation. They may stop in the middle of a conversation and forget what they were talking about. They continuously repeat themselves. They might also struggle with finding the right word in conversation or in a sentence, or they'll call things by an unusual name. They might call their watch a wrist clock, because they can't come up with the word watch. They may start using more descriptive items to talk about things rather than the actual name of an item. So, and difficulty with language can happen at any point in the journey of the disease. So it's interesting. Some people struggle with language very early on, and others, it's not affected until later in the disease. Number 7 is misplacing things and losing the ability to retrace our steps. You mentioned this, we walk into a room and don't know why. And in a healthy aging brain, we may walk into a room and forget why, but if we turn around, take a couple steps back, that recall happens, and we remember. For the person with Alzheimer's disease, they likely are not going to remember, and they may lose things, not be able to recall where they left something or why they walked into a room. They may put things in unusual places. So, and I'm not kidding about this, but maybe putting the car keys in the refrigerator or putting a shoe under the couch cushion, something that's really not normal for their level of functioning.
And is that, Kelly, I'm going to interrupt there. Is that
Yeah.
because they're not sure what the object is, or they're not sure what to do with it, to where to put it, that's happening? Okay.
Yep. And because they have this lack of executive functioning and awareness, oftentimes what happens when they start misplacing things or losing things is that they grow increasingly suspicious of others. And they start accusing others of stealing. Like it's not a case where they think they misplaced it or they realize they misplaced it. But somebody in their environment must have taken it because they can't find it. So they start to become more suspicious of others, and they'll accuse others of taking things or hiding things. And this will likely become more frequent over time. Number 8, decreased or poor judgment. Individuals may experience changes in judgment or decision making. So they may show poor judgment when dealing with money, paying less attention to basic daily hygiene and grooming. So if you notice that your loved one is, not taking care of themselves, they're not eating properly, they're not combing their hair or seeming to take care of themselves. I've had a lot of families say that, they knew something was wrong because their father, who normally made a donation to the local fire company, all of a sudden made 3 donations to the fire company within a month. So those kind of things start to happen.
And Kelly, that's even some examples of some of the other numbers in this, as far as planning or problem solving or
Right.
sequencing. So
Yep.
it's, did I write a check? They can't even necessarily look in the checkbook to see if
Right.
the check was already written. Why am I writing it again? So
Right. They're not balancing the checkbook anymore. They're losing that executive functioning. Correct.
Thank you.
Yep. Number 9 is withdrawal from work or social activities. And I think this is one sign that we sometimes overlook. But as we age, sometimes it's normal as we age to feel, less interested in doing social things. But for someone who's experiencing dementia-related changes, if they have some self-awareness that they're having difficulty keeping up with conversation or they're forgetting things, they may have some fear or concern that someone else is going to catch them making a mistake. And for this reason, people who are really experiencing these type of changes start to withdraw from social activities. They start to withdraw from participating in activities and hobbies that they always enjoyed. So for example, if you have someone who faithfully came to church every Sunday and all of a sudden they're not coming, or you have someone who's always gone to the senior center for yoga class and all of a sudden they're not coming, it could be a sign that they're starting to withdraw because they're afraid someone is going to notice that they're forgetting or that they're making mistakes. So I think this is one that we sometimes overlook, but a thing that we should keep in mind if we see loved ones or friends start to withdraw from activities. And finally, number 10 is...
I'm sorry, I'm gonna interrupt there because it just occurred to me too that like we have to look, and I was gonna say this at the end at this whole picture in terms of all of these things, and as you said, not necessarily happening in any particular order or not getting them all. But with this one, I think I'm glad that this was really pointed out very clearly, because I think also as we age, we lose there's some associated other concerns like depression that may not be related. So if that happens, they tend to withdraw also from social activities, or it may be that we are no longer driving. There's no necessarily public transportation to get to something. So we withdraw maybe, but it isn't as a result of this, it's some other circumstances. So that's why it's really good to kind of examine, and be aware of all these and what's happening. And maybe there is a simple answer like no transportation, or maybe not, or it could be something else.
Exactly.
Thank you.
You're welcome. The last one, changes in mood and personality. Again, individuals with Alzheimer's or another dementia, because of what they're experiencing, because of the losses, that really can make someone become confused, suspicious, depressed, fearful, not understanding why things are changing or why they're forgetting. It makes them anxious. And for all these reasons, all these emotions that these warning signs can cause, a person might get easily upset. They may have a short fuse, as we say, if they're out of their comfort zone or their routine is disrupted by these changes. They could become easily frustrated because they are forgetting or can't do what they used to do. So all of these things can make them seem like they're having changes in mood and personality, and that should be a red flag as well. But as I mentioned earlier, Ann, and as you pointed out, these warning signs are intended to be a guide to help identify possible problems with memory or thinking or behavior that may or may not be related to Alzheimer's or another dementia. So, individuals can experience one, all, or some of these signs in varying degrees, at any point in the process. They don't have to experience all of them at once for there to be concern. So it's important to discuss changes, with a loved one or a friend or a neighbor or yourself, and then to think about, is it, if any of these changes are occurring, one or more, it should be a red flag to at least make an appointment with a doctor, to make sure, as you said, is it a true dementia like Alzheimer's, or is it something like depression that can be treated?
Yeah, so I think that takes us into that next question that I would have. If I've started to recognize that, or, hopefully it'd be nice that others who have seen the program can look at those and others too, and maybe point out that this is going on. So where do we go from here if we start thinking this or suspect that, either in ourselves or with a loved one? We can begin. Where do we begin? What do we do next?
Well, I think the first step is to pay attention to changes that we notice, whether it be in ourselves, a loved one, a friend, a neighbor, somebody at church, whoever it might be. And especially changes that are happening with regard to our memory or our thinking or our behavior. Paying attention is very important in terms of early detection and diagnosis. So it's important that we pay attention to what's going on with our own cognitive health as well as others around us and in our lives, and not to dismiss any changes as normal or, well, that's what happens when you get older, because Alzheimer's and other dementias are not normal. They are a disease state. And there are plenty of people who live well into their life without ever having dementia. So it's not normal. It's not to be expected just because we're aging. And if there's any change that's unusual for a person's current level of functioning, that should be cause for concern. And I think the first action we can take is having a conversation about it, not being afraid to talk about it, about our concerns and what's changing. And then being able to take that step to make an appointment with your doctor or the person's doctor to really sort out what's causing the changes. You know, is it a true dementia? Is it something like depression or a urinary tract infection or, you know, any of the number of things that can cause dementia-like symptoms but are treatable? Because if something is treatable, we certainly want to treat it and be able to reverse it.
Exactly. So Kelly, if I'm observing these in myself or a friend and I'm going, geez, this is happening more frequently, something like this is kind of, it isn't really typically an immediate change. It's sort of a gradual thing, right? So if I'm identifying this, where do you identify that maybe, should we start, you know, I would write those things down. And normally we suggest that when we write things down, when we have questions about whether it's a new medication or whatever, we take that to our doctor. So I'm assuming that we can start by discussing this with our primary care physicians.
We can. Most individuals start the conversation with their primary care doctor. If the family doctor or primary care doctor suspects that the symptoms may be related to a dementia, they will likely make referrals to other specialists, such as neurologists or geriatric psychologists for further evaluation. When you start with the primary care physician, you know that your primary care physician can certainly look at your medical history. They can certainly do the physical exam. They can do a screen for depression. They can talk with close family or friends to see what they're seeing, you know, and get different viewpoints. And then if they feel it's needed, you know, and they feel that the symptoms that the person's experiencing may be related to a true dementia, they will likely refer to a neurologist for further testing that may include laboratory tests, blood work, imaging tests, brain imaging tests like MRIs or CAT scans or PET scans. And those imaging tests can rule out conditions, other conditions that may cause these symptoms, such as having a brain tumor or an aneurysm, or maybe the person had a stroke and didn't realize it, or there's buildup of fluid on the brain. So that's what the brain imaging tests can reveal in terms of the assessment overall. And the diagnostic process, again, can also vary from person to person, depending on their specific situation, their specific symptoms that they're experiencing, and what the doctor feels is the right course of action for that person. So the diagnosis, again, may be something other than Alzheimer's or a true dementia. And that's why it's important to investigate those symptoms and see if there's something that can be treated. And then again, you know, we also have a situation where sometimes the stigma or misconception of Alzheimer's and dementia can sometimes deter people from actually taking that step to see the doctor.
And I think that's what's so important is maintaining our regular appointments with physicians, with our regular primary care doctor, so that he can see if these things are maybe a result of a medication, maybe the result of, as you said, that they detected there was a mini stroke. You know, they know that if they're seeing you on a regular basis, that's another eyes that can see if this is where this is going with you. So if we're looking at this and we're understanding and we've gone, right to, you read my mind. We've already we've talked to the doctor, you know, he's ruled out some other things and we're looking at perhaps Alzheimer's diagnosis. What is next? Where do we go? Where can we get information? How can we learn more about it? How can we begin to set up something for ourselves and understand that Alzheimer's better.
Well, I think you're right, Ann. I think the next step post-diagnosis is that the person and their family and anybody who is going to support them through this, that they get information and support is a really critical step, and to educate themselves about the disease and what's going to, what may happen next, how to prepare for it, to just understand what it is so that you can manage it. Because what's important, what we try to stress through the association is that Alzheimer's and other dementias can be managed, and we can live with Alzheimer's and dementia just like we live with other chronic health conditions, just like we live with diabetes or heart disease or other chronic health conditions that we deal with as we age. So getting education, information, and support is critical. So of course, one of the ways people can do that is to reach out to the Alzheimer's Association. We are available whenever and wherever people need us. So we have, three of our key resources that I wanted to point out today, and what you see here on the screen is, first of all, we have our 24/7 helpline, and it's a toll-free number. It is available round the clock, 365 days a year. Doesn't matter if somebody needs us at 2 a.m. on Christmas Eve. It is truly a 24/7 round the clock helpline. And it's available day or night for someone to receive information and support. We have highly trained master's level clinicians who man the helpline, and they can help an individual with education, with accessing resources, with decision-making support, even crisis assistance. So really, any question, anytime can be handled through our 24/7 helpline. And one thing important about the 24/7 helpline is that it is available in more than 200 languages and dialects. So anyone calling that number can request to speak to someone in their native language. And we also have bilingual staff at the helpline. So very important resource. Of course, we have a lot of information on our website. alz.org is the main website address, and there are just a lot of different areas of our website. There's an area specifically for caregiving on our website. There's areas for people who have the diagnosis on our website. There's an area for professional caregivers on our website. So there's a lot of information and different, again, tools, resources, what are the stages of the disease? What can I expect going forward? What are treatment options? What are care options? A lot of information on the website. And then finally, I wanted to mention, we have a public-facing resource database, and it's called Community Resource Finder, or CRF. And again, that database has many resources, many different categories of resources.
So Kelly, I'm going to interrupt a second and just kind of review, because we're running out of time. So I think that what we can say is that certainly at this point, if we have recognized that, we're understanding a little bit better what Alzheimer's disease is, a little bit about the warning signs, not be afraid to talk about it, to move forward with it by reviewing those things with your physician, doing some appropriate testing and questioning. And then let's go with some good resources through the Alzheimer's Association, whether they be the helpline or on the website, to educate ourselves, to educate others about the process, to be able to understand what's going on, to ask questions, whether they call the hotline, and also if they call the local organization or be referred to the local organization, you have additional information and resources, as well as I think that there's some support groups available in Berks County for individuals. We have, the Alzheimer's has a lot of other connections, resources, and they can do a lot of assistance recommending and referring individuals for other services that may be needed eventually in someone's life. So I'm going to have to conclude here with thanking you, Kelly, and that for helping us to understand what Alzheimer's disease is, giving us this great information. And I'm going to leave this up at the 24/7 helpline of 1-800-272-3900, or alz.org is their website. And I want to thank everybody for tuning in to Aging Matters. Please, if you have any questions about this, feel free to give us a call at the Berks County Area Agency on Aging at 610-478-6500. And thanks so much, Kellie Butsack, for being with us and sharing this program. And stay tuned for part 2, a little bit on the preventive side for any kind of Alzheimer's or dementia disease, with healthy living for brain and body. Check in then, and thank you for tuning in to Aging Matters.
Aging Matters on BCTV is supported by the Berks County Area Agency on Aging.